Welcome, everyone, to Wellness Wednesdays with White Oak Family Medicine. This is Kelly Johnson, the owner of White Oak Family Medicine, and your guide to staying healthy. Our first topic this week is going to be about peptides. They're very much in the news right now. The government's going to be meeting next month regarding opening up more opportunities for peptides. And we get a lot of questions about, first of all, what is a peptide? So, peptides are amino acids, which are precursors to proteins. Amino acids are the individual building blocks that make up a protein. So, peptides are short chain of amino acids. They can be anywhere from about 2 to 50 amino acids long. And proteins are going to be long chains of amino acids, typically going to be over 50 components. Peptides act as similar to hormones in that they're chemical messengers. They guide the body on necessary functions such as producing hormones and repairing damage. Peptides have been around for a while in medicine, although they have only recently become popular. Insulin was the first peptide to be used and dates back to discovery in 1921, but its first use in a diabetic was in 1922. There are now over 100 peptides that are approved for the use in the US by the FDA, but there are currently many more in clinical trials. The GLP-1 agonists, such as semaglutide, popularly more commonly known as Ozempic or Wegovy, that's a recent, very popular class of peptides currently in use for diabetes management and weight loss. Linzess is also a commonly prescribed medication used for IBS with constipation or chronic constipation, and it actually is also a peptide. Peptides are relatively unstable, which is why they typically require being given as an injection rather than available in a pill form. They get broken down too much in the guts typically. Unfortunately, many peptides are currently considered more as a supplement or research grade, which lacks the same level of control as a typical prescription medication. Due to this, there are many inferior products available on the market, so you need to be very careful about where you get them if you are getting peptides. Inferior products can range from ineffective, which basically is just going to be a waste of your money, to even harmful that could cause problems with your health. It's important to ensure that you obtain peptides from a reliable source. Websites that sell without requiring a provider talking with you and reviewing your health information are not to be considered reliable. Please be aware that many of these are not legal for use in the US right now. So even though you're going to hear many people talking about peptides, that does not mean that it's safe to go out and get one. You need to make sure that you review it with your healthcare provider. This webinar here is not designed to be medical advice. We are not telling you to go out and get peptides. We're not saying that we would prescribe you peptides if you came here. We are just saying that this is what's available and it's interesting to know about them um, at this time. If you have any questions, particularly about peptide use in yourself, feel free to talk to us about it. But please be very careful about where you do get them if you decide to get peptides. So we already talked about two currently available peptides, the insulin and GLP-1 agonists, but what other ones are available and what do they do? There are many of them available. Like I said, there's over 100 already approved for use in the US. They're used for things such as treating cancers, growth disorders, GI disorders, and obviously endocrine disorders. It is important to know that many of the peptides people are currently taking are not FDA approved. These peptides are considered to be experimental at this stage. Be aware that many peptides are considered performance enhancers and can lead to disqualification in many regulated competitions. So, I'm going to review some of the very common ones that people are talking about right now. Some of these are up for review at the end of July, some of them are not yet. You may be able to find some of these available some places, but again, like I said, that does not mean that they are legal. Right now, the ones I'm going to discuss are not considered to be widely available. BPC 157, Body Protection Compound 157, is what that stands for. This one's derived from human gastric juice. It is currently considered illegal for sale and is only available in research trials. Under research to help repair damaged tissues, including ligaments, tendons, muscles, blood vessels. It's also been found to decrease inflammation in the gut. Remember, it's derived from gastric juice and may afford some healing to persons suffering from conditions such as ulcerative colitis. Because this one is derived in gastric juice, it can be used in a pill form for those people who are using it for gut disorders. If you're wanting it for more ligaments, tendon, muscle, things like that, some of it's going to break down when taken orally and may be better injected. CJC 1295, again, not FDA approved currently. It's under study for its effects on the pituitary gland and stimulating growth hormone. It is thought to improve muscle growth, increase metabolism, decrease visceral fat, and even help improve sleep quality. Because it is a growth hormone stimulator, one of the concerns is that it may actually, stimulate the growth of some types of cancers. Because remember, what is a cancer? A cancer is an overgrowth of cells. So if you give a cancer growth hormone, what's it going to do? It's gonna continue to grow. So, there is some concern right now that's just speculation as far as, I'm aware at least. I did my research, of course, before recording this, but I am not aware of any proof that it does worsen cancer, but it is something that is under review. TB 500, this is similar to thymosin beta 4, which is a natural component that aids in cell repair in the body. It is suspected that this compound will help with reducing scarring, improve muscle recovery, and reduce inflammation. It helps support the growth of new blood vessels, which helps deliver additional oxygen to damaged regions. This is another peptide with concern for possible cancer link, considering its proliferative effect on cells. KPV helps heal the gut and decrease inflammation. It also has some benefits to skin conditions such as psoriasis or eczema when it's used topically. It's used for digestive diseases such as Crohn's, ulcerative colitis, or leaky gut, and it decreases the inflammatory response without decreasing immune function. So this is great because many of these conditions like the psoriasis, eczema, Crohn's, we're currently having to use biologics on those. Well, biologics are gonna decrease immune function. So one of the big concerns with those patients is that we may control their condition, but we put them at risk for other infections. This one, if it moves forward, if it looks like it's gonna be helpful, uh, it may be able to help those conditions without having that side effect, that risk of, additional infections. DSIP, this stands for deep sleep-inducing peptide. This one's under research for helping to improve sleep quality, decrease stress, and lower cortisol. Dihexa, this one's kind of an exciting one, at least as far as I'm concerned, because of its effects on cognitive function. It's one of the few peptides that's stable as a capsule. Of course, I talked earlier about some of the ones that are derived from gastric juice. Of course, they're going to be able to go through the stomach, but this one is able to be done as a capsule. It is a very small peptide. It contains only 3 amino acids in its chain. Helps with cognitive function and repair of brain tissue. So it may also help to reduce the death of cells within the brain. So not only is it going to help reduce that death, but it also helps with the repair. So it's being investigated for use in Alzheimer's patients and those suffering with Parkinson's disease. This one, there's a lot of interest in a lot of research for those poor patients that just have those degenerative nerve disorders. So, what about the future of peptides? Exciting news is coming in the future. At the end of July, as I alluded to earlier, um, July 2026, FDA's Pharmacy Compounding Advisory Committee is going to be meeting to review several peptides, including that BPC 157 and TB 500 that I discussed. They're going to be reviewed on July 23rd and July 24th. They're going to have some additional ones, including that DSIP, the sleep one. If they move forward with expanding the acceptance of these peptides, it means they will proceed with the legal process to allow peptides to be available to the public through compounding pharmacies. This is not a quick process, folks. As we all know, the government takes their time in deciding things, but the fact that the government's willing to open up discussions about peptides means that the future is looking pretty promising for these. A few years back, the government had a different stance. They had originally said that peptides were bad. They put them on the gray list, if you will, not necessarily a black list, but gray list of really just being used for experimentation. But this is actually opening it up to possible use in the general public. If you have any questions, comments about peptides or wellness in general, feel free to comment below. Do not forget to like us. Thank you for listening and stay healthy out there.